A silent threat. Understanding gonorrhea. Gonorrhea is a common sexually transmitted infection, or STI. It is caused by a bacterium called Neisseria gonorrhoeae. This bacterium thrives in warm, moist areas of the body. These areas include the urethra, cervix, rectum, and throat. The infection can have serious health consequences if left untreated. Gonorrhea often shows no symptoms, especially in women. This makes it a silent threat. Understanding gonorrhea is crucial for prevention and treatment. Early diagnosis and treatment are vital. Safe sex practices and regular testing help reduce the spread. By understanding gonorrhea, we can protect ourselves and others. The spread. How gonorrhea travels. Gonorrhea spreads through sexual contact. This includes vaginal, anal, and oral sex. Any contact with infected fluids can transmit the bacteria. These fluids include semen, vaginal fluids, and rectal fluids. It's important to note that you don't need to have ejaculation to spread or contract gonorrhea. Any intimate contact with an infected person's genitals, rectum, or mouth can transmit the bacteria. Even if someone doesn't have visible symptoms, they can still carry and spread the infection. Pregnant women with gonorrhea can also pass the infection to their babies during childbirth. This can lead to serious health problems for the newborn, including blindness, joint infections, and life-threatening blood infections. Gonorrhea does not spread through casual contact. Sharing toilets, towels, or utensils will not transmit the infection. It's crucial to dispel these myths and focus on safe sex practices to prevent the spread of this STI. Telltale signs. Recognizing the symptoms. Many people with gonorrhea don't experience any symptoms. This makes regular testing crucial, especially for those who are sexually active with multiple partners. When symptoms do occur, they can vary between men and women. Men may experience a burning sensation during urination, white, yellow, or green discharge from the penis, and pain or swelling in the testicles. Women may experience increased vaginal discharge, painful or burning sensation during urination, and bleeding between periods. Both men and women can experience symptoms in other areas, such as anal itching or discharge, sore throat, and redness and discharge from the eyes. It's important to remember that some of these symptoms can also indicate other health conditions. If you experience any of these symptoms, consult a healthcare professional for an accurate diagnosis. Beyond discomfort. Complications of untreated gonorrhea. Untreated gonorrhea can lead to serious health complications. In women, it can cause pelvic inflammatory disease, or PID. PID is an infection of the female reproductive organs. It can lead to chronic pelvic pain, infertility, and ectopic pregnancy. In men, untreated gonorrhea can cause epididymitis. This is a painful inflammation of the tube that carries sperm from the testicle. It can also lead to infertility if left untreated. For both men and women, untreated gonorrhea can increase the risk of contracting HIV. This is because gonorrhea can cause sores and inflammation that make it easier for HIV to enter the body. Rarely, gonorrhea can spread to the bloodstream and infect other parts of the body. This can lead to a life-threatening condition called disseminated gonococcal infection, or DGI. DGI can cause arthritis, skin rashes, and heart valve problems. Section 5. Seeking answers. Diagnosing the infection. Diagnosing gonorrhea involves a simple and straightforward process. A healthcare provider will ask about your sexual history and any symptoms you may be experiencing. They will then collect a sample for testing. The most common testing method involves a urine sample. This allows for the detection of the bacteria in the urethra. Alternatively, a swab may be taken from the affected area, such as the cervix, rectum, or throat. These samples are then analyzed in a laboratory to confirm the presence of Neisseria gonorrhoeae. Depending on the testing method used, results are usually available within a few days. Rapid tests that provide results within a few minutes are also available in some healthcare settings. Early diagnosis is crucial for timely treatment and preventing the spread of infection. If you suspect you may have been exposed to gonorrhea, don't hesitate to seek testing and consultation from a healthcare professional. Section 6. Fighting back. Treatment options and drug resistance. Treating gonorrhea involves antibiotics. These medications kill the bacteria and clear the infection. Drug-resistant strains of Neisseria gonorrhea are a significant challenge. The recommended treatment is a single dose of ceftriaxone, often combined with an oral dose of azithromycin. Follow your healthcare provider's instructions and complete the full course. Drug-resistant gonorrhea is a growing public health concern. Bacteria develop resistance to antibiotics. Overuse and misuse of antibiotics contribute to resistance. Healthcare professionals are exploring new antibiotic options, engage in safe sex practices, and get tested regularly. Section 7. Shielding yourself. Prevention strategies for everyone. Preventing gonorrhea is crucial for protecting your health and the health of your partners. Practicing safe sex is the most effective way to prevent the spread of this and other STIs. Consistent and correct condom use during sexual activity provides a significant barrier against the transmission of Neisseria gonorrhoeae. It's essential to use a new condom for each act of sexual intercourse and to ensure it's used correctly. Regular STI screening is paramount, especially for individuals who are sexually active with multiple partners. This allows for early detection and treatment, reducing the risk of complications and further transmission. Choosing monogamy, meaning having a mutually exclusive sexual relationship with one uninfected partner, significantly reduces the risk of contracting gonorrhea. Open and honest communication with your partner about sexual history and testing is essential for informed decision-making. Section 8. A shared responsibility. Public health measures. Addressing gonorrhea effectively requires a collaborative effort involving public health initiatives, healthcare providers, and individuals. Partner notification plays a vital role in controlling the spread of the infection. When someone tests positive for gonorrhea, public health officials and healthcare providers work to ensure that all sexual partners of the infected individual are notified, tested, and treated if necessary. This helps break the chain of transmission and prevent further spread. Antibiotic stewardship is another crucial aspect of public health measures aimed at combating gonorrhea. This involves using antibiotics judiciously and appropriately to minimize the development of drug-resistant strains. Public awareness campaigns and educational programs are essential for disseminating accurate information about gonorrhea, its transmission, symptoms, and prevention strategies. Empowering individuals with knowledge enables them to make informed decisions about their sexual health. Section 9. Living with gonorrhea. Long-term effects and stigma. While treatable with antibiotics, gonorrhea can have long-term physical and emotional effects. In some cases, particularly if left untreated, individuals may experience chronic pelvic pain, infertility, or an increased risk of ectopic pregnancy. The social stigma associated with STIs, including gonorrhea, can lead to feelings of shame, guilt, and isolation. This can prevent individuals from seeking testing and treatment, perpetuating the cycle of transmission. It's important to remember that STIs are common and treatable medical conditions. Seeking timely medical care and engaging in open communication with partners are crucial steps in managing the infection and minimizing its impact on one's life. Breaking down the stigma surrounding STIs requires fostering an environment of understanding, support, and access to accurate information. This empowers individuals to make informed decisions about their sexual health without fear of judgment or discrimination. Section 10. Taking charge. Your role in combating gonorrhea. Combating gonorrhea requires active participation from individuals, communities, and healthcare systems. Take charge of your sexual health for a healthier future. Educate yourself about gonorrhea, its transmission, and prevention. Practice safe sex by using condoms correctly. Get tested regularly for STIs, including gonorrhea. Communicate openly with your partners about sexual health. Embrace these actions to advocate for your health and combat gonorrhea.